Well, good morning. We are here with Cindy Hogberg, a Medicare expert here in Spokane. Thank you so much for being here, Cindy.
Absolutely.
So Cindy, I want to jump right in. Open enrollment is going on right now, and we know that there's been some changes. So tell us more about what Medicare users should know.
Okay, absolutely. So open enrollment is October 15th through December 7th of every year. So that is the time when anybody can make changes to their plans, choose a new prescription drug plan, choose a new Medicare Advantage plan. There seems to be a move towards more HMOs, which are health maintenance organizations, and away from the PPO, which is a preferred provider organization. And I think that's a good thing because Medicare was actually designed for managed care. The government decided that the private insurance carriers can manage care more effectively and at a lower expense than the federal government. And we're kind of moving back to that model where you do have a primary care physician that is basically, I like to think of it, the hub in the wheel and helps to manage that care. So we're definitely seeing that happening right now. Also, prescription drug plans, the pricing is going up quite a bit on that, some changes in formularies.
That was one of our big questions, is what happens there for people who get a lot of prescriptions. What does out-of-pocket look like for this upcoming year?
Okay, so maximum out-of-pocket in 2025, they changed it to a $2,000 maximum out-of-pocket. That is going up to $2,100 in 2026, so still fairly reasonable. There is also something called a prescription payment plan. Basically, if you have high-cost prescriptions that you're going to hit that $2,100 in the first couple of months, then it's going to make sense to go ahead and sign up for this prescription payment plan. And what that will do is that will spread those payments out for the entire year.
Okay.
So you're not paying $2,100 up front.
Correct.
Okay, gotcha. That makes sense.
Correct. That is done through the insurance carriers. So if you sign up for that plan, you do not pay at the pharmacy when you pick up your prescriptions. You will get a bill from the insurance carrier.
That makes sense.
It is, however, not something that is good for everybody because if you don't have those high costs up front, then there's a different algorithm, the calculation for it. You can actually end up paying more later on instead of less.
So, you know, when people are reviewing their options, they might have to be forced to choose between coverage and cost. What would you advise them? What would you say to them?
So what I'm going to say is that a Medicare Advantage plan is a health insurance plan. We have gotten really used to all of the nice shiny objects, and we have all of this dental, and we have over-the-counter products and vision and fitness and all kinds of different things that have been added into them over the years. And we're kind of going back to basics.
Gotcha.
Back to a healthcare plan, which is why you have insurance. So, you know, do you care about that great fitness benefit where you can buy a ski pass this year, or do you care if you're covered if you have a heart attack and you're in the hospital? So really going back to the basics, we aren't gonna have as many shiny objects as we used to, but really those were fun and nice to haves, but that's not why you have insurance.
And we got to wrap things up, but how can people get more information?
Absolutely. So there are several brokers in the Spokane area. I actually am filling in for Lynn Wold today, who got stuck in an airport someplace, so was not able to make it. But Health Insurance Options, they have a location right by Sacred Heart. Feel free to reach out to them. Happy to help you.
Perfect. Thank you so much for being here this morning.
You're welcome.